Hello, our NGO Nalondo Butta Medical Foundation is soon getting its practicing license certificate of operation by mid-July 2025. And our plan runs for a period of 5 years, effective July 2025 up to July 2030. And the work plan is expected to cost US dollars 278,000, which is a big sum of money. However, we expect to raise those finances in majorly the following ways. Number one, fundraising for our community programs and activities, donations and grants from well-wishers, funders, partners, or companies, free financial dedication and financial provision from the founders of the NGO, and also finances from the subscribing members or friends of the organization. And our plan majorly covers 5 major point programs, of which our NGO will operate following. And the 5 major point programs or 5 major point objectives include the following. Number 1, establishment of baseline works for the smooth running of the NGO. This involves identifying our localities, our branches, and starting our NGO activities officially. Remember, our NGO activities started last year, 2024. We started with community participation, whereby we were doing psychoeducation of people in small groups. We are registering disadvantaged people in our community, that is within Nakasongola district, within Wakiso district, and a few in Manafa district. The time frame of the establishment of the baseline works is for a period of 5 years, ranging from this year up to 2030. But remember, the programs occur simultaneously. There are those which we shall cover this year, there are those we are able to cover before, and there are those which will keep on covering day by day as we get finances until 2025. But our major goal in establishment of our works, we expect to construct and complete our NGO headquarters within Manafa district by the end of 2025. And our estimated budget is roughly 25 million shillings. The next second major objective is launching of medical services at the organization offices. Remember, so far we have 2 offices of our NGO. The headquarters being in Nalondo Butta village, Nalondo sub-county, and Manafa district. That's where our headquarters is located. However, we have a liaison office in Wakiso district, and that is exactly at Subi Medical Clinic, which is our partnering clinic for the NGO. And it's where we're taking this video from. Our medical services also started 1 year back, 2024, with us registering disadvantaged people who are already benefiting from free medical services, and also we look forward to registering more people who will benefit from the free medical services. Therefore, we shall need partners to keep on supporting us in our goal to reach out to bigger populations. And our major aim also is to open up and construct a free hospital which will provide free medical services to our people within Uganda. Our hospital is estimated to be at a level of a health center for sub-district, and we expect to construct it in Manafa district. Three, the third major objective is enabling access of quality education to all disadvantaged children within Manafa district. Remember, education is the key to success. Education is also a key to health. We plan to support all disadvantaged beneficiary children within our NGO with scholastic materials. We started this exercise of donating scholastic materials last year, 2024, and this year, 2025, in the first term. We are able to give free books to children within Nakasongola village and Nakasongola Ame village, which is a village of disadvantaged people who were once soldiers and got some physical and mental challenges due to military service, and sometimes due to the disease progress. We also plan to keep on donating more scholastic materials to different children of different age groups and in different schools, both within our working districts and other children within our reach. We also look forward to registering and starting up a vocational skills center whereby children who drop out from secondary or primary or university are able to attain skills for self-sustainability. The vocational skills that shall mainly focus on include tailoring, mechanics, hairdressing, catering, secretarial services, bricklaying, to mention but a few. And that work plan also ranges for a period of 5 years, effective July this year up to 2030. But the limiting factor to the speed of the projects will be the finances. The more the finances we shall have, the faster the activities shall be implemented. Number 4, our fourth objective is ensuring enough quality food for sustainable nutrition. We, being in a flood-developed country, it has come to our notice that very many people come to hospital especially children below 5 years, when they are malnourished. And you find out that this comes right away from their homes, their families, when they don't have what to eat. They don't have foods, they don't have sauce, they don't have protein energy building foods, and neither the carbohydrate building foods. We therefore look forward to ensuring and supporting low-income developed homes through donating them food, seedlings, and cereals for them to come up with sufficient food for their home consumption. It's therefore a big challenge for us to fight. And also, we shall look forward to starting up a mini factory which will be adding nutrients to food. For example, fortifying the maize flour, cassava flour, and so many others. And also processing some foods, for example, nuts, to be able to add a nut-based sauce to the diet of children in order for us to fight the protein energy malnutrition. And number 5, we shall look at our last objective of ensuring access to safe and clean water. We shall also look at ensuring access to clean, safe water. And in this, we shall do this by psychoeducating and sensitizing our community about waterborne diseases. And also mobilizing our communities in cleaning their water sources, which might be wells, boreholes, taps, whatsoever they might be using. And lastly, we shall mobilize for funds so as we'll be able to construct clean water sources for our individuals. For example, a water bottle, a water tap, or a water borehole for our communities. Therefore, your support, your financial contributions, and your prayers are highly welcomed for us to have success in our NGO. Thank you, and watch our next videos for the next programs. Thank you, and bye-bye.